Do you consider yourself too healthy to experience a heart attack? Think again. Even the fittest personal trainers and athletes can suffer from heart attacks. Heart attacks are striking both the young and the old. Such reports have become increasingly common. Are you worried about your own risk? Everyday habits and seemingly minor health issues could be affecting your heart. What might appear as minor symptoms or routine lifestyle choices could be warning signals of heart problems. Identifying these neglected signs is crucial, as they can seriously elevate your risk of experiencing a heart attack. In this video, we'll unveil 9 diseases and everyday habits that could pave the way to a heart attack. Stick with us till the very end, because this health information could be a lifesaver for you or someone you care about. Number 1, it's time to review your daily eating habits. Your dietary choices directly influence your body's health. Eating a diet high in saturated fats, trans fats, and cholesterol increases the risk of heart attacks. Consuming high-fat foods leads to the buildup of fatty plaques in your blood arteries. These plaques cause your arteries to thicken and stiffen. Plaque buildup can also reduce blood flow in the arteries, affecting the blood supply to the heart. Many of the foods you consume daily are rich in unhealthy fats. For those who relish fried foods, red meat, potato chips, and various snack foods, it's essential to be mindful of these dietary choices. This also extends to lovers of full-fat dairy products and those with a sweet tooth for baked goods, cookies, and pastries. Each food item can contribute immensely to the intake of saturated and trans fats, adversely affecting heart health. If you find it difficult to avoid eating certain foods, try not to make them a daily habit. Instead, opt for fresh vegetables and fruits as healthier alternatives. Swap palm oil for olive oil, and be mindful of your overall dietary choices. Taking control of your eating habits can save your life. Number 2, is smoking or alcohol part of your daily routine? Smoking doubles your risk of a heart attack. It can trigger a heart attack by increasing your blood pressure and heart rate and reducing the amount of oxygen that reaches your heart. Cigarette smokers are more prone to heart diseases. Even secondhand smokers are at a high risk of developing heart disease and ultimately experiencing a heart attack. Smoking causes thickening and clotting of blood, which can lead to a heart attack and sudden death. Smoking, combined with unhealthy dietary habits, can be alarming. It's important to quit smoking altogether, as it can harm not only the smoker, but also those exposed to secondhand smoke. Do you also have a habit of regularly drinking alcohol? Beware, as it can rapidly increase your blood pressure and ultimately lead you to a heart attack. This elevation in your blood pressure can stress your heart muscles and lead to cardiovascular disease, which poses a higher risk of heart attack and stroke. Number 3, is there a history of heart attacks in your family? Is there anyone in your family, including parents, siblings, children, grandparents, grandchildren, nieces, nephews, aunts, or uncles, who has developed heart-related diseases? If so, you may be at a higher risk of a heart attack. It's important to take precautions early on, such as controlling your diet and engaging in physical activities, to mitigate the risk of heart disease and other related conditions. You might wonder why you're susceptible to heart disease if it runs in your family. It could be due to inherited genes that predispose you to heart issues. However, it's not just one single gene responsible. Several gene defects can collectively contribute to heart diseases. While you can't entirely eliminate the risk of a heart attack if you have defective genes, you can reduce it by up to 50% by early precautions like controlling your diet and engaging in regular physical activity. If you're finding this video informative, subscribe and press the bell icon. Get ready for the next risk factor that can cause a heart attack. Number 4, ever tested for high cholesterol or triglycerides? Prior to exploring the role of cholesterol in heart attack risk, let's clarify that there are 2 kinds of cholesterol, good and bad. High-density lipoprotein is a good type of cholesterol. Its function is to remove bad cholesterol by taking it to the liver, where the liver detoxifies it. Non-high-density lipoproteins are bad cholesterol that cause fatty deposits to accumulate in the blood arteries and disrupt the blood supply to the heart, causing blockages. This can lead to a heart attack. Similarly, high triglycerides can cause the stiffness of your blood arteries. They also thicken the walls of the arteries, causing heart attacks and heart disease. High cholesterol does not have any symptoms. You should have a blood test to identify it. A fresh and unprocessed diet can help you maintain healthy cholesterol levels. Number 5, diabetes, a silent killer. Linked to heart issues? Diabetes is known as the silent killer. It harms nerves, eyes, kidneys, and heart. According to a report, up to 22% of people with diabetes develop heart failure, and the incidence of heart failure in diabetic people is increasing. Diabetes can also cause kidney damage, preventing them from filtering blood effectively. High blood pressure is also linked to diabetes, making it harder for diabetic patients to recover from heart disease. Consequently, they are more prone to sudden heart attacks. If you are a diabetic patient, it's crucial to keep your sugar levels under control, maintain kidney health, and manage your blood pressure. Healthy weight loss, being active, and a good diet can prevent you from sudden death. Number 6, how your weight impacts your heart health. Excessive weight is directly linked to heart disease. It can cause fatty material to accumulate in your arteries, affecting the supply of blood to your organs. If the arteries to your heart get clogged, it can lead to a heart attack. Similarly, clogged arteries leading to your brain can cause a stroke or dementia. Overweight people often have high blood pressure because their heart needs more force to pump blood throughout their bodies. The harder your heart works to pump blood, the higher your chances are of experiencing a heart attack, kidney damage, eye problems, and stroke. Obesity can lead to high cholesterol, which may cause heart disease. However, being overweight does not automatically mean your cholesterol levels are high. A blood test is still necessary to determine this. Nonetheless, if you are overweight, you are at a higher risk of having elevated cholesterol levels. Obesity can also result in elevated blood sugar levels, which can lead to diseases such as heart disease. Losing weight is a solution for this type of heart attack, but it should be done in a healthy way. Losing weight in an unhealthy manner can damage your heart. Number 7, avoiding workouts. Lack of exercise can significantly impact your heart health. The heart, being a muscular organ, requires physical activity to strengthen. The more active you are, the stronger your heart becomes. Regular exercise enables your heart to pump more blood to your organs throughout the body, enhancing its efficiency. A healthy exercise regimen not only makes your heart stronger, but also keeps your arteries flexible, reducing the risk of blood clots. Furthermore, exercise can improve conditions like high blood pressure, obesity, diabetes, and elevated cholesterol levels. Combining physical activity with a healthy diet is the most effective strategy for heart health. While regular workouts are beneficial, it's important to exercise mindfully to avoid potential heart damage. Excessive or improperly conducted exercises, such as continuous running without adequate breaks, prolonged workout sessions, or extreme weight training, can increase the risk of a heart attack if not performed correctly. Listening to your body and adopting a balanced approach to exercise is crucial for maintaining heart health. If you find the video valuable, please be sure to like and share it with friends who share these health-concerning habits. Also, if you exercise regularly, share your thoughts in the comments. Number 8, heart attack risk increases in pregnant women due to preeclampsia. Preeclampsia is a condition where a pregnant woman experiences high blood pressure and protein in the urine. This can lead to heart disease and heart failure. Women in developing countries are more prone to this condition. Preeclampsia can cause long-term hypertension, a risk factor for heart attacks. It damages the inner layer of blood vessels, impairing effective blood supply and leading to heart attacks. Preeclampsia also causes thickening of the left ventricle, making it harder for the heart to pump blood. Women who have experienced preeclampsia have an increased risk of developing cardiovascular diseases later in life, including coronary artery disease, heart failure, and stroke. Additionally, some women continue to experience high blood pressure postpartum, further elevating their risk of cardiovascular problems. It's not possible to entirely prevent preeclampsia for all women, as some risk factors are beyond control. However, steps can be taken to reduce the risk and mitigate related symptoms. Early and regular prenatal visits enable the early detection and management of high blood pressure. Monitoring your blood pressure, watching your weight during pregnancy, and eating healthy foods are key. Regular, low-intensity exercise can also reduce risks related to preeclampsia. Limiting caffeine intake and completely avoiding alcohol, tobacco, and illicit drugs can further reduce the risk. Being aware of preeclampsia symptoms, such as severe headaches, vision changes, upper abdominal pain, and sudden swelling of the face and hands, and reporting them to your healthcare provider immediately can help in managing the condition more effectively. Number 9, how the intake of illegal drugs can trigger heart attacks. Illegal drug use, particularly with stimulants like cocaine and amphetamines, can significantly increase the risk of a heart attack. These substances can trigger a coronary artery spasm, a sudden temporary tightening of the muscles within the artery walls. This spasm can restrict or completely block blood flow to the heart muscle, potentially leading to a heart attack. The risk is further heightened because stimulants can also increase heart rate and blood pressure, strain the cardiovascular system, and contribute to the formation of blood clots, all of which are risk factors for a heart attack. In conclusion, the choices you make every day, from your level of physical activity and the foods you eat to your use of substances and overall lifestyle, play a crucial role in your heart health. Neglecting these aspects can silently pave the way to serious complications, often unnoticed until it's too late. The heart, your important engine, demands attention and care. Adopting regular health checkups and adopting attentive lifestyle monitoring are not just recommendations. They are essential strategies for maintaining your well-being. Let's commit to these practices, integrate them into your daily lives, and ensure a healthier, safer future for yourselves. With that being said, thanks for watching, and until next time, stay tuned for more exciting content. See you later.